health insurance and managed care of Nigeria is key to getting it right in the country. And for many years back, this institute has stood for that. I want to thank the national coordinator of this institute, the person of Mr. Moses Aibu, for the tremendous work he and his colleagues in this institute have stood for. At a time when Nigerians believe that all that matters is about money and politics, this institute has stood for building the capacity of personnel that are employed in all aspects of the health financing ecosystem in Nigeria. And we want to thank God for what they have been doing. So as I welcome you all, I want to appeal to the government at the federal, at the state and local government level. I want to appeal to the organized private sector, and I want to appeal to international agencies that they need to work with this institute if we are to get it right in Nigeria. In many universities today, the curriculum involving health financing is still very weak. That is why this institute is most germane and is most appropriate if we are to get it right. And the event that is being held today is an event that seeks to recognize those who have made tremendous efforts in collaboration with this institute and with other aspects of the ecosystem to make sure that Nigerians get it right. So on behalf of the Board of Trustees, the executives of this particular institute, and all the coordinators and other personnel who have worked tirelessly, I want to welcome you distinguished ladies and gentlemen to this event. And I want to congratulate in advance all those who today are being recognized for their achievements, for their tremendous effort to ensure that Nigeria moves ahead.
It is now that this initiative is on that things began to change. If you ask anyone in Nigeria, they say the insurance is not working. And some of us that are working day and night, pursuing the cause of health insurance, we know it's working. We know people are getting treated at the hospital level. We know millions of Nigerians are gainfully employed through the National Health Insurance Authority and through the scheme all over the states of the Federation. So we are persuaded that this cause is worth doing and is worth making the world to know that something new, something special, something that is commendable is happening in the health insurance industry. And the award since last year has been able to achieve a lot because we wear our spectacles to look at what is going on both at the national level and also at the state level. And many of the states are now doing well. A round of applause to the states health insurance agencies. If these are the hope, the states have restored the hope of Nigerians in the National Health Insurance Authority or the scheme generally. Because as it were, when it was only the national government, you were around the NHI, people feel that what is going on. But when it comes to the states, people began to feel that, oh, this thing is now, people, the momentum begin to get, exponential. So we are sure that, and we are persuaded that if we can drive this process in the next 10 years, we are going to see a different sector. I told people, I said, this is a sector that is untapped.
And as you know, in the WHO balance, the best way to pay for health care is through health insurance. And if you have seen over the years, many countries, including Nigeria, of course, as difficult and challenging as the Nigerian health insurance system is, we should still clap for ourselves that we have it. Many countries try, and many governments have failed. If you read the history of the United Kingdom, one of the thorniest problems in the US is the NHS. It breaks down and breaks up governments. Can just collapse the government overnight. And in the US, the most advanced country in the world, the health insurance is the biggest problem Even though health contributes to about 25% of the GDP, that is huge from one sector alone. But getting health insurance on that way is a huge and turning problem. During President Clinton's administration, which is a long time ago, there have been about 3 or 4 presidents since then. If you multiply that by 8 of 2 terms, that's about 24 years and counting. When it was president, the wife took on the very difficult and bold task of trying to champion health for all or health insurance in the US. She failed. She failed for a number of reasons, some of which was she felt she was very smart and didn't carry the legislation along. So there was no champion in the legislation to take a proposal forward. Nobody was prepared to stand behind the bill to be passed. After doing all manners of stakeholder consultations across the country from coast to coast and prepared with, was a very smart lawyer and prepared, but there was no champion in the assembly, in the US Congress, to take it forward. And that failed in a very disastrous way. And just to further underscore that health insurance is not just only something about protecting people's life, it's a developmental issue. And without it, a lot of countries cannot achieve desired indicators for health. And also going back to the US, until you have President Barack Obama, who brought about the affordable health care, which is popularly now called as the Obamacare. Okay, so for the first time, they managed to patch it together. What story am I trying to paint? I'm trying to paint that we are in a very important sector of a national government. And we should hold this, it's like this is in your hands, because you are the repository of knowledge, capacity building, and being in the forefront. If there is a legislation coming up in the house, you will be in the forefront, because not only are you practitioners, you are seasoned, some of you have worked in various HMOs institutions, even the National Health, the NHIA as it is called now, and so people will be counting and looking up to you, to play the leadership role. And now that you have an institute, you know what an institute is. You need to grow it, you need to make sure it is known, you need to invite people to it, you need to take it from one level to a higher level, wherein you can begin to issue certificates, professional certificates. You need to go through that, you can do it. And not only can you do it, it's something of a gap, sorely needed. And so you need to find out how this is done and become a subset by affiliation to be a recommendation to an existing institution, maybe University of Abuja or any other one that is liberal enough and willing to work with you, because an area in which tremendous capacity building is required. And you will be surprised that many people in Nigeria here will want to take on to that particular area of advancement.
One thing to ensure that we have taken it upon ourselves that we will use this one as a stepping stone to make sure that health insurance in Nigeria
making healthcare accessible to everybody. So everybody, but unfortunately, what we see today is in a stratified way. Okay, so we're going to those areas that have stratified way of payment. So, but universal insurance scheme, we're trying to ensure that everybody, every Nigerian, partakes in this universal insurance healthcare. So, what do I say about it? It is not lacking. National Health Insurance Scheme Authority has done a lot. They have really done a lot, captured people, and we police officers are beneficiaries of this. Because if you come to the Nigerian Police Force, we use our National Health Insurance, and it is helping our officers. It's helping us to pay for our health services out of pocket. So we know that healthcare is accessible to a common policeman.
Ishe, the state contributory scheme, were established by different laws of different states to purchase healthcare service to our respective citizens of various states, and to ensure that the citizens of these states are well protected against catastrophic medical costs. So that does.
Getting so much from this health insurance. The less privileged have access to health insurance. Now there's a 350 bed hospital, which is also to bring to the people, bring health matters to the people. The Akwa Ibom governor is working so hard to make sure that health is not an issue. People no longer have to be traveling out of the state to get their health to restore. So